Meal preparation is about promoting health, honoring personal preferences, and ensuring safety. As a caregiver, your role is to create a clean, safe, and respectful environment while preparing meals that meet your client's specific needs. Check dietary restrictions, allergies, religious guidelines, or medical diets. Look for notes in the kitchen, for example, no dairy, kosher only. Ask the participant or family about food preferences and forbidden ingredients. Wash hands and wear gloves before handling food. Use clean utensils, surfaces, and tools. Prepare meals simply and in line with the client's preferences. Sanitize all areas before and after cooking. Use separate cutting boards and utensils for raw and cooked foods. Change gloves after handling raw meat. Never reuse tools without washing and disinfecting them. Wash dishes with hot, soapy water. Wipe down counters, stove, and high-touch surfaces. Take out kitchen trash when finished to avoid pests and odors. Do not prepare meals if you are feeling unwell. Notify the agency immediately. If cleared to work, wear gloves and a mask at all times during food handling. Label leftovers with name and date. Keep hot foods hot and cold foods cold. Never leave out too long. Allow the participant to choose their meals or snacks when possible. Store food properly in sealed containers inside the fridge.